of the common condition which I see in my clinic is heavy menstrual bleeding. It's a very common problem, and heavy menstrual bleeding cannot be quantified as such, but people will suffer and they will possibly think it's a normal to have this kind of period. But actually it can lead to anemia, tiredness, fatigue, have a severe impact on the quality of life and impact on their working environment. So it's very important that if the periods are heavier, just speak to the doctor and contact them. When I see someone in my clinic with a heavy menstrual period, my first step is to take a full and thorough history to see what exactly may be happening. There could be other causes such as hematological issues, clotting issues, which will be contributed to the heavy menstrual bleeding, in addition to gynecological problems such as fibroids, hormonal problem, which can lead to heavy menstrual bleeding. After examination, I will do an ultrasound scan to check for issues like endometrial polyp inside the uterine cavity or fibroids, which are very common. After the diagnosis is made, the next step is to treat heavy menstrual bleeding. And there are many ways to treat it. One of the first interpretation will be, if no abnormality is found during examination, then it's simple things like tranexamic acid 1 gram orally 3 times daily along with mefenamic acid may suffice to help with the heavy menstrual period. However, hormonal treatment such as progesterone, combined oral contraceptive pills and Mirena IUS can also be very helpful to help with heavy periods. On the other side, there are many surgical options as well available for heavy menstrual bleeding, but those surgical options will depend what we find during our initial assessment. For example, if I find that there is a polyp inside the uterine cavity or a fibroid growing inside the uterine cavity, then that can explain the symptoms, and then an operation called hysteroscopy and removal of that fibroid or polyp may suffice. Hysteroscopy means a small camera goes from down below, can go through the birth canal inside the uterine cavity. We can look into the screen and we can remove that fibroid and a polyp under direct visual guidance. On the other side, if there's a larger fibroid in the abdominal wall, then we have to consider operations like myomectomy. Now, given that we have moved on from laparoscopic to robotic myomectomy now, which means robotically removal of fibroid, we can remove even bigger fibroid what we were able to do with the laparoscopic approach in the past. Because robotic surgery allows us now to remove much bigger fibroid in a much safer and efficient way as well. Apart from this myomectomy and removal of fibroid, then there are new things as well and new treatment coming up as well, such as Sonata, which can also help to treat the fibroids without the needing for a surgery. But the important or the holy grail of management of heavy menstrual bleeding is to listen to your patient. Number one, to diagnose what causes the problem and then coming up with a bespoke solution to manage the heavy menstrual bleeding. It could be a simple medical treatment, it could be a major surgery like removal of the fibroid, and in extreme cases removal of the uterus, we call hysterectomy, or things like Sonata, uterine artery embolization to help with the heavy menstrual period. The important thing is to get the right diagnosis. So in the management and treatment of heavy menstrual bleeding, we take a step-ladder approach. In that one, the first simple step could be to treat them with simple medication such as tranexamic acid and mefenamic acid. These can be taken regularly at the time of their period and can make the bleeding lighter and help with the symptoms. The second step will be to give them some hormonal treatment such as progesterone. Mirena IUS is a very good treatment and can help with heavy menstrual bleeding. On the third step, if during our assessment and ultrasound scan we find that there are fibroids, polyp and other causes which are causing the problem, then we have to look at the surgical intervention. And surgical intervention range from simple things like NovoSure endometrial ablation, new treatments like Sonata for fibroids, and going all the way to removal of fibroids. Removal of fibroids is called myomectomy, and myomectomy can be done open myomectomy if the fibroids are very huge, or with a keyhole surgery called laparoscopic myomectomy or robotic myomectomy. Given that now we have robotic myomectomy, we can remove even larger fibroids safely with a keyhole surgery. The important thing, however, is that these fibroids should be removed in a bag in a very safe manner so not to cause any problem.